Well, my practice specialises in body contouring type surgery, which is quite a wide range of procedures. It's for massive weight loss patients, it's for people who've lost weight both from bariatric procedures or just by being healthy and wanting a change in lifestyle, to mummy makeovers or people who just have something that they want to try to adjust or change. So I do all types of procedures in that context on the chest, abdomen, thighs, arms, and back, mainly focusing on like breast reduction, breast lifts, tummy tucks or abdominoplasties or body lifts, which are really important in the people who have a lot of excess tissue and skin. Also, there's stages that you have to do, so it's really important to go to someone who has experience in all those fields, who does it in a safe, reproducible manner. So a big part of my practice is body contouring, but like I said, that encompasses quite a lot of procedures. I also use a lot of liposuction, which is really important. And I think with the advent of new technologies and using vases and lipo like that, we can really get some really ideal results for patients at a very quick rate. So that's really good. In terms of other types of procedures, I love hand surgery. I do a fair bit of hand surgery in both the public and the private sector, as well as skin cancer, which I think is is so prevalent in Australia. It's hard not to see people and look after them and do that for them. And then there's the general reconstructive type procedures. But if I got to choose, I get a lot of joy, a lot of passion out of body contouring. ASPS as well is really good from just a networking, communication, and being able to keep abreast of all the things that are happening in our field, which is quite a lot. So especially with me focusing so much on my practice and techniques and the patients I look after, to have a professional body that can actually explain things or inform you of what's happening around and how it works with the government and funding, it's really important. So ASPS does a lot of good work, and I'm really, like I said, really privileged to be a member of it. I think it's a critical part of our profession. This meeting is of an international standard. It gives us an opportunity to make sure that the level of surgery that we're performing is up to an international standard, as well as making sure that our results are in keeping with our peers, but also that we're learning the new technologies of what's out there, how we can innovate, how we can enhance the results, because yesterday's 10 out of 10 is tomorrow's 9 out of 10. So we always want to be pushing forward to be getting good results. So that educational side is really important, but just as important is the networking, meeting other colleagues, other people, discussing your cases, because I don't think any person is an island. You always come across complex or difficult scenarios, whether it's technical or ethical. So to be able to sit down and talk to a peer and understand how they may approach something gives us a broader base of doing the right thing for our patients. So I think, as I said, education, continued education, and having focused time just to do that one thing, not just be flicking between patients or at night time when you're tired of the young family and all of those other factors that make life busy, but to come here and dedicate that time for learning and to be reinvigorated. That's the other big factor of these meetings. The passion that I already have just gets fired up again when you come to something like this and you see someone's results and how they're doing it, and you just I want to do that. I want to make sure I can do that. That's really good. And the last thing I say is the industry. When you're walking around the industry floor and you're looking at all the new types of equipments and the little subtle things that can actually just change your practice to make sure that we get the result that can reduce the recovery time for your patient and give them that wow result, that's really important as well. And that's probably the most time I ever get to do those things. It was pure luck, to be perfectly honest. I was actually thinking of giving up medicine in my last year, as I hadn't found my passion. And just by chance, someone gave a lecture on plastic surgery, and it was the most, like a light bulb moment, just hits you. It was, wow, this was so interesting. People were doing, it was a bit like a magic trick. If you didn't know what they had done beforehand, you couldn't work out how you got from here to here. And it was innovative, creative, it was detailed, and it really kind of just inspired me to want to have a look more into the field. And from there, it just got better. So it's the people that I got to work with, it's the people that I got the opportunity to look after. It just became a revolving cycle of that. And I think plastics is just the most fabulous specialty, because for me, it's not about life, I guess, and giving people longer lives, but it's giving them quality of life or enhancing life. And that's the biggest thing you can do, have a positive effect on someone so they can move on and have a good life. And that's a real privilege to be able to do.